Hello, I'm Siri Vaith, Executive Director of the Cystic Fibrosis Research Institute, and I welcome you all to this follow-up question and answer session with Dr. Raksha Jain. Dr. Jain gave an incredible presentation on men and women's reproductive health in the CF community at our recent 34th National CF Education Conference. And at the conference, we very sadly ran out of time and were unable to ask the many questions that had come in. So thank you, Dr. Jain, for returning to answer these questions. And for those of you who did not see Dr. Jain's presentation, just to share a little bit about her, she is the Associate Professor of Pulmonary and Critical Care Medicine and Director of the Adult CF Center at the University of Texas Southwestern in Dallas. She's also co-director of the Site Therapeutics Development Network program. She's been in the field of CF for 15 years as a clinician and researcher, and her main areas of research interest revolve around women's health disparities, particularly as they relate to sex disparities and sexual and reproductive health. We are so grateful to you, Dr. Jain, for returning to answer our questions.
I'm happy to be here.
So I will read each question and straight as they came out and take it away after I ask the question. Are there studies regarding irregular menstrual cycles for assigned female at birth people with CF?
So this is a good question. And unfortunately, there are not systematic studies about this as of yet. Hopefully there will be in the future. There have been some small studies done that overall show that women with CF are not likely to have a higher rate of irregular menstrual cycles than the general population. The caveat to that is that often correlates with nutritional status. So for example, women with CF who their nutritional health is in a good, healthy place, they tend to have fairly regular menstrual cycles. For those who are quite malnourished, that's when we often see an increased risk of irregular menstrual cycles. But we haven't really done big prospective studies to understand this in depth. We just have those few trends that we know right now.
Thank you. Has anyone looked into male carriers to see what their testosterone is like or in related to bone issues? Obviously, male carriers can have children, but has there been any research into carriers and their hormones or anything related to fertility?
Oh, this is a terrific question. And I actually think we really need to do this kind of work. Right now, when it comes to carriers, there haven't really been studies about testosterone levels. And we actually have not even studied that in people who have two CF mutations very well. So that's something that hopefully will be coming in the future. What we do know, interestingly, about male carriers is that some of them actually do have infertility. And if you recall in my discussion, I presented that the vas deferens, for whatever reason, is particularly sensitive to CFTR mutations. And there actually have been observations that some people with even a single mutation in CFTR that we would call carriers do have absence of the vas deferens. It's not at all the majority, but there have been reports of that. So there is really a lot to be understood still about CFTR and its connection to male infertility. But as far as the connection to testosterone levels, that is something we have a long way to go, but will be coming, I think, in the next several years.
That is fascinating. I am learning. Can you tell me about the CFRESH study funded by the CFF using a period tracker app?
Yes, so I probably can't give you exact details. I'll definitely tell you what I do know. So the two primary investigators that are leading that trial are Emily Godfrey and Sandy Suffian. And I do know that they're already enrolling and they're using electronic apps and enrolling women to allow them to track their periods at the same time that they track symptoms, etc. I do not know, or I don't think there is yet data available, but if you have any more questions, I know Emily Godfrey is at the University of Washington and Sandy Suffian is in Chicago. And I think either of them would be great resources to contact about what they know and what's coming in the future with that study.
Great. Is there any connection with the severity of endometriosis in CF females?
That's really interesting. And again, I would say we don't know, but a few things that do stand out that are unique about CF and endometriosis is actually extrauterine endometriosis. So what endometriosis is, for those who may not know, it's actually having uterine tissue in parts of the body that are outside the uterus. For some women, that's in different parts of the abdomen that can cause chronic abdominal pain. And interestingly, there are also reports of this endometrial tissue in the lungs. And one form of how this can present is that people actually cough up blood at the time of their menstrual cycles because this endometrial tissue in the lungs is shedding like it would in the uterus, essentially causing bleeding. And there actually was a case series just recently, and in fact, myself and a few other people were on that report describing what we call catamenial hemoptysis, which is coughing up blood in relation to a menstrual cycle, potentially because of endometrial tissue in the lung. But outside of that unique aspect, I don't think we know much about whether it presents more severely in women with CF than it does in the general population. So that's still something we, again, need to do more work on.
And this wasn't in the chat box, but now I must follow up. Endometriosis obviously impacts all women. I mean, not every woman, but regardless of CF.
Yes, absolutely.
So that tissue in the lungs, would this happen to women in the general population as well, or is this unique to CF?
Yes, absolutely. So that is something that is described in the general population. Nothing that I described about the endometriosis is unique to women with CF, but what is unique, I think, is that there is a little bit increased risk of bleeding, whereas a woman in the general population may have endometrial tissue in the lung that may bleed, and that may also not bleed because they don't have the same tendency to bleed. Whereas in CF, I think when this happens to women, the tendency to bleed is much higher just because the risk of bleeding and cystic fibrosis is higher.
And so how does a clinician tease out for a woman with CF if it's, you know, standard hemoptysis, for lack of a better term, and that related to endometriosis?
Great question. And it actually is not easy. It takes a lot of time. And it really takes working with that woman in helping track, are these symptoms of hemoptysis correlating directly with the same time as menses? And if that's found to be the case, often one of the first lines of therapy is to put somebody on a hormone contraceptive to suppress the menstrual cycle, which would then suppress that endometrial tissue in the lung, and see if that helps. And it's not that it's foolproof, but typically if it is largely from endometrial tissue, you'll see some benefit. So it's a lot of sort of, you know, having to navigate tracking this over time, and then what works and doesn't work, and trial and error to see if it, and often it's never a perfect diagnosis. It ends up being what we call a diagnosis of exclusion when all other things were ruled out.
Is there any increase in cancer of the reproductive organs for women and I suppose men with CF?
Yeah, so that one is a really tough question. And I would say we definitely don't know yet. I think as people with CF are living longer and healthier lives, which we're thrilled about, we all do wonder about cancer risks as people are getting older. There's a lot known that inflammation is associated with risks of cancer. As of right now, we don't have any reason to believe that there's any particular unique increase in risk in the reproductive organs when it comes to cancer. But I would also say we have never looked at this in a thoughtful manner to answer that with data. So right now we don't know. I certainly hope not, but that's something we need to look at in the future.
I think the awareness of colon cancer and the higher risk has really made people start to think, well, where else is this having an influence in the body?
That's exactly right. That's probably the one we're learning the most about right now.
What is the most commonly used birth control for women with CF?
Oh, so that may be the one question I can't answer. So actually there was some work done again by Emily Godfrey, who's out of the University of Washington. She and several of us at a few centers joined together and took a look at this, at least within a handful of centers, to look at what is the most common contraceptive therapy used. And we found that it is combined oral contraceptive therapy, meaning an estrogen and progestin combination. And that mimics what is out there for the general population as well, that combined oral contraceptive therapy tends to be the most common. So I believe the numbers were about 40% of women with CF chose that option. But again, there was many that had other different types of therapies they used.
We keep hearing about the Trikafta baby boom. Is there any data on women in their 40s being able to become pregnant when they weren't able to prior to starting modulators?
Ooh, that's a good question. So I don't think there is specific data on women in their 40s. There have now been a number of reports of women on either ivacaftor, Kalydeco, or Trikafta who thought that they could not get pregnant before. They even had been to OB-GYNs or fertility doctors who had deemed them infertile, and then magically they get pregnant. And so actually, Dr. Jennifer Taylor-Kauser and I published a paper in the Journal of Personalized Medicine of one of our patients actually who, very interestingly, this was with Kalydeco, not with Trikafta, but the mechanisms and effects are very similar, where we had a woman who prior to being on Kalydeco had been deemed infertile. And there was these wonderful pictures her OB-GYN had taken where she had very thick mucus stranding in her uterus and her cervical area. And then she went on Kalydeco, went for routine follow-up and her OB-GYN noticed that there was not nearly as much mucus, took a subsequent picture, and it was near resolution of that thick mucus stranding. We actually have the pictures in this publication, but it really goes to show that we certainly believe it's quite possible. We don't yet have systematic data on it, and I don't think we necessarily have any data on women in their 40s, so that's something that we need to definitely take a look at. But I'm hopeful, even with studies such as the Mayflower that's going to be following women who do get pregnant, we're going to get their history and understand some of this, that, hey, this was a woman who thought she was infertile, wasn't trying to get pregnant, and boom, now she's pregnant. And so we'll probably learn a little bit more about that, even though that's not the primary focus of that study.
And how much do we love that we're having conversations about 40-year-old women with CF?
I know. Great.
Pregnant inadvertently. So someone said, you may have said this and I missed it. Does Trikafta influence your recommendation for birth control for women with CF? Meaning, does it impact hormone-based contraceptives?
Got it. That's a great question. And I did mention it just briefly. And so Trikafta does not interact with hormone contraceptive. So women can really choose any form of contraception they would like, and there's not thought to be an interaction with Trikafta. The one CFTR modulator that is thought to interact with hormone contraception is, or can be, or ivacaftor lumacaftor, where it's thought to potentially decrease the efficacy of hormone contraception such that they recommend that women use some type of barrier protection or a form that is not going to rely on hormonal modulation. But all the other modulators are thought to be safe with no known interaction.
And now, staying on the theme, we're moving past 40. Let's talk about menopause.
Yay.
What is the impact of menopause on women with CF?
So I love this question, yet I have to entirely admit we have no idea yet. I think this is absolutely got to be one of our priority questions. And, I think for reasons we all know, it has not been a focus, but I think as we have more and more women that reach menopause, go well beyond menopause, that we've got to understand this, particularly because, as I outlined early in my discussion, there are some definite thoughts that hormones can impact health of somebody with CF, and particularly estrogen. And in menopause, estrogen levels will decline. So is that good? Maybe. Is it not? We don't know. And this also lends itself to a number of questions about hormone replacement therapy and how will that affect a woman. But really, as of right now, we have a complete absence of data in this area. So I think it's got to be on our list of priorities of what we look at.
Yeah, because immediately I started thinking, do women go through menopause earlier or not?
Right.
I'm thinking about bone health, absolutely.
Absolutely, yeah. Yeah, and I think the challenge on some of these types of questions is a lot of our large resource of information is the CF Foundation Patient Registry. And these are just, data points that we have not been capturing. And we're hoping over time it can be something that we do capture. It just, I think the more and more questions that add to the registry, the more challenging it is for clinics, but yet some of these we'll have to prioritize and really see if it can be something that in the future could be part of what we ask, so we can study this in a large manner to understand when are people going through menopause. That's something you can't learn in one center or even a couple centers. You have to have a much bigger database to know that.
Well, I am so grateful to you for coming back to answer these questions. I just want to entice people who were not at the conference. Beginning in September, we will release all the presentations, the recordings on our YouTube channel. And so I strongly encourage you to listen to the complete presentation by Dr. Raksha Jain. So much information. Those photos she mentioned, I believe you shared those in your presentation.
That's right.
The standing. It was an amazing presentation, and I encourage everybody to go back. If you did register for the conference, you're able to log back in and watch her presentation again. So I thank you for taking the time to return to answer these burning questions.
Oh, my pleasure. Thank you so much for having me.